Now, an official at the World Health Organization says developing a vaccine to help fight the Ebola outbreak in Central Africa could take months. The warning comes as more cases of the deadly virus are being reported in the Democratic Republic of Congo. The EU is preparing to send about 100 tons of medical aid to the DRC, where the virus has been linked to nearly 140 deaths so far. The head of the WHO says that figure is unfortunately expected to rise. Dr. Ancia is the WHO's representative in the DRC, and she joins us now from Kinshasa. It is really good to have you on the program as we all wait to learn more, really, about what this outbreak entails for the continent over the next few days and weeks. Can you give us a full update now on the very latest? I know you've been in the field, so what have you learned?
Yeah, I am still in the field actually, because the plane that was supposed to get me back to Kinshasa has never arrived. So I'm still in Bunia for the time being. The situation is very preoccupying. You know, this outbreak was discovered and confirmed a little bit late. It was already rampant for a few weeks before it was clearly diagnosed and declared by the national authorities. So you know, the provinces where this outbreak is also unfolding are provinces that have, you know, high insecurity, a lot of movement of population, and the population are very vulnerable because they've been actually affected by a humanitarian crisis since years. The Ituri province is the seat of communal and ethnic conflict since, as I said, since many years. Which has led to more than 1 million displaced people right now. And as I said, a lot of very vulnerable population. In addition, you know, the budget cut that the humanitarian communities and the health sector faced in 2025, you know, that there has been in DRC, the health sector budget decreased by 70% in 2025. So really, it has been very difficult to be able to keep the humanitarian assistance that for all those populations we really had to prioritize. In addition, as I said, this province is really with high insecurity, and the hotspot, the epicenter of this outbreak, is actually in an area that is a little bit hard to reach and very insecure. In addition, this outbreak has now spread to the town of Bunia, where I am right now. And we've got, therefore, also an outbreak that is developing in an urban and highly dense area, which will make it even more difficult to tackle. The outbreak has already crossed over to Uganda, where there has been 2 imported cases, but so far there is no more case. There are several people who are under surveillance for the time being. But the outbreak is also disseminated in the southern province here, the province of North Kivu, which is another province where there is a huge humanitarian crisis that has been there for several years, since actually almost 1994, and that has been exacerbated last year by the town of Goma, where you've got cases for the time being. The town of Goma being taken by the M23, and therefore not anymore under the governance of the national authorities, but under de facto authorities governance. And the town of Goma is also very close to the border of Rwanda. So Rwanda has closed its border, although it let the humanitarian assistance getting in for the time being. But before, the humanitarian assistance were coming from the airport of Goma, which has been closed since last year. Then the third hotspot for the time being is also still in the province of North Kivu, a little bit more north, in an area called Butembo, where we've got also several cases, and that area was already severely affected by the last outbreak of Ebola subtype Zaire in the huge outbreak that happened in 2018 and 2019.
Dr. Ancia, you've certainly given us a very sobering a breakdown of what exactly you're looking at here in terms of the challenge. You are still in Bunia. What are you seeing there on the ground? Do you continue to see people who bring in loved ones who believe they are symptomatic? How's the testing going? And obviously then the contact tracing.
Yes, so you know, we are at day 3 of the response, and we are much better organized than on day 1. We managed to bring health professionals and health experts, both from WHO and the Ministry of Health. We've been managing to bring supplies on the ground, and we've got more and more partners who are also reaching and arriving in Bunia to be able to help bringing a response in a much more coordinated manner. So what we see is really a response that is getting well organized. Today we have actually we are transferring actually suspected and confirmed cases which were actually hospitalized in the hospital of Bunia and in the hospitals of Wampara. Those hospitals were overwhelmed, and actually, even if the suspected cases were tried to be put apart, there were no real condition for infection prevention and control being put in place. So now we are transferring those patients in another hospital that will be specifically dedicated to the treatment of Ebola, and where very strict and robust infection prevention and control measures will be put in place. So we are also very much working with all the communities. So we are working with religious leaders, community leaders, teachers, any kind of influencers. We are working with taxi drivers and truck drivers, so that we can start disseminating messages for risk mitigation, risk prevention, and really trying for the population to protect themselves and prevent.
Dr. Ancia, I thank you so much for your information. As I said, you've given us a very stark picture of the challenge ahead, and we thank you just for filling us in on what's going on the ground there. Thanks so much.